My name is Kate Hilton, and I'm delighted to serve as a member of the ICANN faculty team. Welcome to Lesson 2. Our objectives in this lesson include understanding organizing as a theory of change, learning about the interdependent leadership model and practices, getting tips for designing an ICANN project, and learning the basics of resourceful and adaptive strategizing. We're going to begin this lesson by talking about organizing as a theory of change. What is a theory of change? Think about the change you want to bring about. How will you go about achieving it? The way you answer this question depends on your assumptions and understanding about why things are the way they are and what needs to happen to alter them. A theory of change is an if-then statement. If only we do X, Y change will occur. This is what we mean by theory of change. So what theories of change do we commonly employ in quality and population health improvements? For starters, technological innovations. The idea here, if only we implement this innovation, it will fix the problem. For instance, if we wash our hands before touching a patient, fewer infections and less harm will occur. Organizers ask, but how do I get you to wash your hands in the first place? The solution alone won't solve the problem. You have to get people to commit to doing it. Another theory of change, awareness raising. If only people were informed, they'd change their behavior. For instance, if we raise awareness among smokers, they'll quit smoking. The assumption here is that people don't need to be persuaded, motivated, or held accountable by others. Another theory of change, providing information or training programs. If only acquire this knowledge, we'll change our behavior. So, for instance, if we train people to eat healthy, they will eat healthy. Or if we train people in lean methodologies, they'll go back to their wards and implement changes that increase productivity and staff satisfaction. Marketing is another theory of change. If we sell our idea, people will take it up. In the health setting, we sell services as commodities and treat patients as clients, and sometimes as customers. So for instance, if we take out ads or use Facebook, Twitter, email, people will attend our event or seek our service. Compliance is another theory of change, using incentives, rewards, or punishments. If we use a carrot or a stick, we can make the change happen. So for instance, if the CEO demands the use of the surgical checklist, surgeons will use it. Service is perhaps the most commonly used theory of change in healthcare. In this theory of change, we act or do something for others or on behalf of others. In the service theory of change, there is not an us that unites us because we don't act together with one another. For instance, some providers may see themselves as practicing medicine as a service on behalf of their patients, as opposed to working together as a team to make shared decisions around health and healthcare. The intent is good. We want others to benefit through service-oriented action. For instance, if we offer a free screening, people will manage their diabetes. Finally, access is another theory of change. If I make something available, everyone will use it. For instance, if we provide people with insurance, people will use primary care. These are all great ways to move from where we are to where we want to be, to work collectively to generate systems change, as we discussed in Lesson 1. We need to employ all of these theories, but none of them are organizing. What is organizing's theory of change? Unlike marketers who appeal to the preferences of their customers or philanthropic providers who dispense services to needy clients, unlike social entrepreneurs who devise technical solutions to challenging public problems, organizers identify, recruit, and develop leaders. They build community around that leadership, and they create power from the resources of that community. Our shorthand for this is people, power, and change. In other words, in organizing, our theory of change is based on relationships and power. In this context, power is not something you have by virtue of the position you hold. It's not a quality or a trait. It's influence created by the relationship between interests and resources. In organizing, we assume that the world is the way it is because some people benefit. We also assume that these people currently have more power than us and are therefore able to maintain the status quo. Community organizing then focuses on power. Who has it, who doesn't, and how to build enough of it to shift the power relationship. That shift is what makes change. As a theory of change, organizing is usually most appropriate where the challenge you face requires developing new collective capacity, new power, to deal with it. It can also work to accelerate and amplify other theories of change, where you need new collective capacity or commitment to use a technological innovation, raise awareness, or provide a new service. In this case, it may be about combining with other theories of change. In organizing, we ask three core questions. First and foremost, who are our people? We start here because our power comes from our people, not from the problem. Organizing is about the people with the problem, mobilizing their own resources to solve it and keep it solved. So it's only after asking who are our people that we ask, what is the source of our power? Reverend Martin Luther King described power as the ability to achieve purpose. Power is not a thing, quality, or trait. It's the influence created by the relationship between interests and resources, the capacity that's created when resources are creatively combined. So, if your interest in my resources and my interest in your resources gives us an interest in combining resources to achieve a common purpose, we can develop our collective power. We call this power with. But if your interest in my resources is greater than my interest in your resources, I can influence our exchange more than you. I have more power than you. We call this power over. So organizing is not only a commitment to identifying more leaders, but also to engaging those leaders in building power with one another to create the change they envision. Organizing power begins with the commitment by the first person who wants to make it happen. Without this commitment, there are no resources with which to begin. Commitment is observable as action. The work of organizers begins with the acceptance of the responsibility to challenge and enable others to do the same. So once we've analyzed our power, we think about how we're going to harness it to affect change. In organizing, change is a specific, concrete, and significant act. It requires a focus on measurable goals, specifying a goal or an aim that is clearly visible, then mobilizing our resources to achieve it. We're going to come back to choosing measurable goals when we talk later in the lesson about strategizing as a leadership skill. For now, let's turn to what we mean by leadership in organizing.